So this is really just going to be a review of first aid, okay? Anyone that went through the scouting program, first aid was like the most mandatory of all your merit badges to even get a tenderfoot, I believe. So probably nothing extraordinary, but it's good to review this and think about it. The most important thing in first aid is to think about airway, breathing, and circulation, okay? Oh, let me scoop that. Thanks. Oh, we'll see if we get it back. Okay. First of all, we'll just talk about a special consideration in airway, which is choking, all right? And I think everybody has heard of the Heimlich maneuver, right? So you're only going to use the Heimlich maneuver if someone is actually not breathing. Okay, if they're coughing, choking, something like that, don't attempt it. Okay, so what's the best way to find out whether they're breathing? Ask.
Are you choking?
Okay, now we're going to demonstrate how this goes.
So these are his ribs, right? And so you just go right in between, right here, and then you're gonna, push up. And yeah,
Michelle, harder. Come on.
Okay, very good. Here's another demonstration of it. Here's a little curve, okay? The American Cross is now saying, do this. Go 5 back blows, okay? All you used to do is 5 back, biot blows and back blows until they came up with the Heimlich maneuver. Now you cycle through, okay? So with me, I'm probably instinctively going to go right to Heimlich maneuver, but if that doesn't work, after 5 times, I'm going to try this whack on the back, all right? Supposedly the whack on the back is the first thing, but 5 blows on the back, then 5 of these compressions, okay?
And you hit pretty hard.
You do it pretty hard, yes.
You do it as hard as you can?
depends on how strong you are.
Yeah, maybe that's it.
I saw a guy do it, and he was literally picking the guy up off the ground,
Yeah, I did too.
throwing him around the room and everything. It was just like, wow.
Thank you. If a child needs it, you're not going to press as hard, okay? And you want to get down on their level, okay? So that's what this diagram is all about. So be a little more gentle with the child. With the baby, you definitely go to the back blows first. So put this baby palm down on your arm. Still choking, okay? Now we put her like this, and we're going to use 2 fingers on the sternum, actually, not really the belly, but kind of the lower chest. We're going to go 1, 2, 3, 4, 5. Still choking, okay? Try it again. Okay, I think it came up. Okay, so you cycle back and forth, okay, with 5 and 5, all right? Definitely start with the back blows with the baby, face down, okay? What about a pregnant woman, okay? And I'm actually talking about a woman that is really pregnant, okay? Not just someone who's not even showing yet, because then you're just going to do it the regular way. You're actually going to target the lower chest right here, okay, instead of the belly. And it's not so much a matter of, you're going to hurt the baby, as you're not going to be able to get your arms around it, okay? You're going to have more luck getting the pressure on the chest. Same goes for somebody with a big belly, like this, my friend the elephant here. Okay, instead of trying to, get my arms around that, you go right up here to the lower part of the chest and do it that way. Okay, I'll do it as hard as I can.
Is the purpose that you're pushing air?
So you're trying to push the diaphragm up is basically what you're doing, or in the regular Heimlich maneuver, and that way you're forcing the lungs to expel air, okay? If you're going to do it here, you're really acting directly on the lungs. But yeah,
So the air would go up.
you want the air to push it out, the air that's in their lungs to push the foreign body out. So, thank you. Okay, you can do it on yourself. You find a chair or something like this. Do it. Get down on the table. Right. Now, if you don't do this on everybody, you might find down. But if you saw somebody choking or witnessed choking, do you want me to exchange that? No. And
Look how wet he is.
you just want to get down on top of them like this, okay? Probably most of you have seen this before in health class or wherever you learned about Heimlich maneuver, but you can do it on an unconscious victim too. Okay, so we talked about that specific airway consideration. Now let's just go to the patient that you find down, okay? They're unresponsive, or maybe you saw them collapse, but they definitely weren't choking, and they just kind of keeled over or something. What's the approach? Well, first of all, you got to make sure they're safe, okay? If you found them in the middle of a highway, you're going to want to like either drag them off the highway or set up cones or something to protect them, okay? Next thing to do is check for responsiveness, and usually that's the sternal rub, okay? They don't respond to to your voice or a painful stimulus. They're unresponsive. Next thing to do is make sure their airway is open, okay? And the best way to do that is with this head tilt, and that will get the trachea lined up straight here. If someone has their head tucked over, that's more likely to occlude their airway. So, next thing to do is to check the airway. Just do a finger sweep, okay? Look at their chest, see if they're breathing. Put your ear down next to their nose or nose and mouth. You establish, and if they start breathing with these maneuvers, the chin maneuver and stuff, lay them on their side because that's going to help keep their airway open. Okay. If they don't start breathing, next thing to do is check for a pulse. Okay. And if there's no pulse, we're going to CPR, okay? And probably a lot of you have, learned CPR before. That didn't help very much. But the latest protocol that they have published is actually 30 chest compressions and then 2 rescue breaths, okay? Used to be like a rescue breath every 5 or 10 compressions. It's now down to like 2 rescue breaths for 30 chest compressions.
What's a rescue breath?
You put mouth to mouth, or if you've got, something else, a bag or something.
And you close the nose right before you breathe into.
Yeah, that's a good point. Okay, quiz. How deep do you go with the compressions?
Break the ribs.
Seriously.
That's good. Yeah, you want to press hard, okay? So 2 to 2.4 inches. I know where they get that 2.4, but you want to go at least 2 inches deep. Probably not 3. I guess that's why they put that funny number in there, so you don't go too deep. But that's how deep you're supposed to go with your compressions. So we got Mr. Allen here. We're gonna go. Okay, he collapsed the whole floor.
But in terms of,
Broke all his ribs.
Yeah. Okay.
Should have
Okay.
brought your mannequin, Jim.
I don't have a mannequin. Yeah, I'm not really a CPR instructor, but okay. Next quiz question. Okay, what's the compression rate? How fast are you going to go with your compressions?
BG stays alive.
So it's 120 minutes per minute, and like Brother Robertson said, staying alive. Okay, this is a great tempo. It's about 108 beats per minute, that song. Okay, but I don't know. You want to demonstrate?
okay.
We'll see.
So right there, let's.
Good job.
So that's a way to remember, your rate. You may like the song, you may not, but everyone knows it. So, okay.
Now, can I just add something? So you just keep doing it until help comes. You don't say after 2 minutes like, oh, he's dead, he's never coming back. You just keep doing it. You can do it for 10 minutes, and I do know just that they can come to even after 10 minutes. So you don't give up, right?
Yeah.
Until
Right. If you got a second person, that's great. You can take turns so you don't get too tired. You definitely want to call 911 once you've established there's no pulse and they're not breathing, okay? And get someone on the way that, has better equipment.
If 911 is not available, we're calling you. We're calling a doctor.
The only trouble with that is if there's a big emergency, They call in all the doctors to the hospitals. So you might need to do it on your own. So
They say if you're uncomfortable with the rescue breaths, that just doing the compressions is,
Yeah.
keep do the compressions is the best.
yeah, in fact, I heard from one of the CPR instructors that probably the next edition they're just going to leave the rescue breaths out anyway, because the air is going in and out of the lungs just with the chest compression. So,
And
thank you.
into your rides, the machines, because they don't do compressions like they put a machine on that does it. It does break their ribs. So,
Yeah, we see it all the time, okay? Because I'm a radiologist. I see the x-rays, the CAT scans, you know, and there's a bunch of fractured ribs usually after they've done that. So,
they've done this machine now, just make sure you don't pass the stuff for
yes, Paul.
I wonder if Bishop, maybe we get a list of all the doctors and all the medical
Yeah,
people.
there's one being compiled.
Okay.
What do you do if they're not breathing, but you find a pulse?
Yeah, that's kind of that's you might assume they're choking. I don't know, and then try the Heimlich on them. That's an unusual situation, but possible. Yeah. Anyway, okay. So
I have a question.
Yeah,
How
go
would you
ahead.
do the Heimlich if they're down on their back?
if they're down on their back, you
Well,
just-
they're unconscious. Let's just say if they're down,
so you just get on top of them and do it and do the Heimlich from.
but you're lower than the heart.
For the Heimlich?
Yeah. Well, I mean, where would you put
In
your
between the
hand?
sternum, or?
Oh, yeah, no, on the belly, unless it's like
On the belly?
unless it's a pregnant woman or a guy with a really big belly, you're not going to get good compression down there.
Okay.
Yeah. Okay, so getting back to, so we talked about airway, breathing, circulation. Okay, so, and we talked about just now, it was the heart pumping, okay? Another consideration with circulation is heart's pumping, but, you know, it's not, the blood's not circulating very well. They got really low blood pressure. Okay, that's called shock. Okay, when I was a scout and went through first aid, they said, oh, shock kills them. What the heck is shock? It just means really low blood pressure, dangerously low blood pressure. So how do you address bleeding? If that's the cause of their circulatory collapse, their low blood pressure, direct pressure. Okay, that's your first go-to. All right, I cut my hand right here. Okay, I'm going to try direct pressure. If that's not working, it's still spurting out blood, arterial blood. You might try a pressure point. Okay, also dressings. Dressings are actually important because they'll make the blood pool there, and when you got blood there that's not moving, it's going to make clots more likely to form. So, like a piece of cloth, a piece of gauze, whatever you got, that's helpful to stop the bleeding. You know, even more than just your bare fingers, but use your bare fingers if you have to. I got a diagram with the pressure points, and then tourniquets is another way to stop bleeding. There's also a bunch of there's quick clot gauze, and there's a couple powders that you can put on a wound to help promote, clotting.
Yeah, and the war moves, they use sulfur or something?
Sulfur? I don't know. I know there's a powder that they use, but I don't think it's just sulfur, but maybe it is. You can buy it, and if you want to add that to your first aid kit. Here's some of the pressure points. You hurt your leg down here. It's still pulsing blood. You can't stop it. Someone else hurt their leg. You can help by putting pressure right there on the femoral artery. Okay, and a lot of times that will stop the bleeding. Okay, if not, kind of your last resort is a tourniquet. Here's one. Okay, we're going to assume they've got a worm down here, just bleeding. So you put the tourniquet on here. You put a stick in it, twist it, and then put another bandage around to keep that from unwinding. Okay, that's kind of a makeshift tourniquet. Okay.
I've got a question about that. If you do that, are you assuming that they've lost the leg?
There's collaterals, and some blood might be squeezing through. Some, from maybe a blood vessel that's not, leading directly to the wound. You do so. How tight do you make it until it stops bleeding, right? Okay, or until you could stop the bleeding with pressure. Okay, But yeah, you want to avoid this because sometimes people are going to lose a limb or something if their limb goes without blood for so long. It's surprising how long you can go. Okay, like I've gone into knee surgeries before, and they'll put a tourniquet on really very tight, and they'll like squeeze all the blood out and everything. It's just to minimize the bleeding during surgery, and these will be like 20 minutes or something. Okay, and then they'll release the tourniquet, and the blood will come back when they're done with their surgery. It's more likely going to be if you've got someone for like 3 hours in a tourniquet or something. Then you've got a greater chance they're going to lose that limb. But it may be worth it, okay, so that they don't die. Okay, so yeah, we've been talking about all those different causes of low blood pressure. How do you treat them? Bleeding, stop the bleeding. Sepsis, that you're going to treat the infection. A vasovagal episode. What is a vasovagal episode? It's more regulated by the central nervous system. Okay, somebody's had an emotional trauma, or they look at the gore from their bleeding leg, and you've got that to deal with in
Then
addition
they
to the
faint.
bleeding.
They faint,
they
right?
faint. It's fainting. This is a fancy word for fainting, but it can actually be fairly serious. How do you treat that? Head down, legs up, right? And anaphylaxis. Okay. Anaphylaxis is a severe allergic reaction, and there's a couple of components to it. You can have, including the low blood pressure. There's also airway swelling, stuff like that. Okay, very serious. I know this isn't first aid for most people, but if you've had a severe allergic reaction before, you probably want to have an EpiPen. Okay, this is a really easy delivery mechanism. You stick it in your thigh, you hold it down for about 10 seconds while it delivers the medicine. So that's something to think about if you've got a family member who has severe allergies. Now, why is it important? Like if somebody faints, to treat them for shock, elevate their legs. Okay, and say, oh, they're going to get over it and they're going to be fine anyway. They're going to survive anyway. Well, they might survive, but sometimes they can have tissue damage, including brain tissue damage. Okay, this is a CAT scan of a brain. Okay, kind of like slicing it through like this. And here we have areas of stroke. Okay. The reason for that distribution, there's a big artery that comes up here, the big artery comes up here, big artery here, big artery here. That in this area in between, in the area in between, you're not going to get as good a blood flow. So you get what we call watershed infarcts. So somebody faints, don't just say, they're going to be fine, they'll get over it. Go ahead and put their legs up, get their head down, do all that stuff, okay? This probably wasn't from fainting, but just the reason to do it, okay? We'll skip that slide. Okay, moving on to another topic of dehydration. And if somebody's been, sweating a lot, they're outside on track, whatever, and or they've got diarrhea, you want to just give them water.
And some salts.
So if you just have a lot of water, a lot of free water, the water will go in and it'll go back out. Okay. Okay.
Because the tissues are,
Yeah.
it's not getting to the tissues.
It's
right?
not getting to the tissues. It's just going into the bloodstream and then going back out, filtering back out. So you got to have a little salt. Okay. So if you do that, then the water will go in and it'll be absorbed and distributed through those tissues that are dehydrated. Okay. So, what's a good way to do that? Is Gatorade the best option? Or some sports drink like that? It's not a bad option if you're out, dehydrated because you're, trekking or something like this, okay? If somebody's dehydrated because of diarrhea, probably not a good idea, especially if it's full sugar Gatorade, because that's going to make the diarrhea worse, okay? You can't go wrong with this combination. A little bit of salty soup, ramen soup, whatever. They're all super salty. That'll make them thirsty, and then they'll drink the free water, but they'll keep that free water. Okay. So, incidentally, a sugar drink like that is actually pretty good if you're vomiting. because it'll make it go the other way. Of course, you'll have diarrhea then, but it'll drag that fluid through your intestinal tract. Okay, minor cuts and scrapes, clean it up. Use some antibiotic ointment if you've got it. That's good to have. It actually works, like Neosporin, and cover it up. Okay, if it's a really dirty wound and you want to torture yourself, you can rub alcohol on it or something like that. Okay, hydrogen peroxide. Okay, last thing, bone and joint injuries. The key is immobilization in the first aid setting, right? You just want to get that injured bone stabilized. If it's the neck, this is especially important. You want to try not to move them. Okay, if they dove into a pool, hit their head on the bottom, and they broke their neck, you got to get them out of the pool, obviously, But or they're in the middle of the highway, you might have to carefully move them. But you want to really minimize any movement and actually stabilize them with your hands if you don't have like a neck brace or something, which most people wouldn't. Splints and slings, you can improvise your own. Here's one, presumably a broken leg here. You taped it to this board and tape both legs together. Another improvised sling with a sweatshirt. Other thing, I'm sure you all know, but if somebody has had an injury to their leg or foot, you want to avoid weight bearing. So I hurt my foot. Michelle's going to help me. Okay, you can do this. All right, it's something I always used to teach us. So. That's all I have. Sorry it was so long too.
I've been around a couple dislocations,
Yes,
and if you're out in the middle of nowhere, should you just try and give it a yank, or?
you can. Yeah, usually you're talking about. Usually it's a shoulder, right? I mean, so you can dislocate
A
other
couple
joints.
fingers and a shoulder, yeah.
Yeah. Usually you're going to want to have to pull it out a little bit and then slip it back into place because it's going to kind of one bone will slip in front of the other and stuff like that. A shoulder, a lot of people can wait till they get to the hospital or something, but yeah, you can definitely try. Depends on how dire the circumstance, and you can get them to the hospital. Better to do it there. So.
I've actually put my son's arm back. He pulled it out of what he was socket, and so what I did is I had it just relaxed. I had it. It was like this, and so I kind of pushed it in and twisted it, and that did it. So I don't know.
How did you know to do that?
Huh?
How did you know to do that?
It happened a couple of times.
It had happened before.
Okay.
And so I saw a doctor do it. Yeah.
Yeah, another that's nursemaid's elbow. Okay, very common in young children. Another way is to put your thumb right on where you think the radial head will be, and then bend their arm up. Some people learn these things. Okay, if they've had kids with a lot of dislocations, and some guys who dislocate their shoulder often will even learn to reduce it themselves. So, but I would, if you have the option, I would take them to the hospital just to, minimize the trauma. Okay, because a lot of times when you're reducing a joint, you're going to bang the two bones together and you get a fracture too. So, people who've had more experience with it, better to let them do it if you can. So, all right, sorry that was super long.